Well, I'm glad to be a part of this cone party. I thought I was the only cone, but obviously I'm not, because there's many cones in here, and I'm glad to meet all of you.
You're still special though, Mary.
We are very special cones.
But you do seem rare when you go in there and say you got keratoconus and you talk to people and you like, I'm the only one.
I'm the only one.
But it's nice to see that people are, here with you, don't went through it and everything going good.
I'm actually beginning to feel that is normal, because the first time I heard that word, I said, what? I said, my son had keratoconus. I said, he has what?
I call him what?
Yeah. I've had glaucoma, I've had so many other, infections, but, keratoconus, what is that? Then when I came over here, Dr. Gulani explained to me it was a defection of the cornea, and I read more about it. Yeah. So I've really, been educated about the whole thing, and I was very impressed about what happened yesterday. It was highly impressive, and my son is. This is what we've been going on. It's been going on for the past 23 years, and I can see that he's now feeling much better. He has the confidence that if I can only get this done, and we finally got it done. So it's just the healing process that we're going through right now. I know, and it's another lease on life.
Yeah, it feels good.
Absolutely.
The only thing you thought at one time, it was either surgery, like you got transplant, or you're gonna have to wear these hard contacts forever. That sucks, really.
Absolutely.
Now you got other options, and I love it, man.
Yeah.
I've been wearing
Gulani gave them because that's what.
Yeah, and then until I came here,
Exactly.
everybody else is like, I don't know what to
Can't
do
do
for
nothing.
you.
You're gonna go blind in 10 years. That's what
Exactly.
they told
And
him.
you looking at them like, really? Like, that's my only option.
Wow.
I've been wearing the rigid gas permeable, the hard lenses for 40 years.
Oh, how did that work for you?
And I'm going up 10, maybe about 10 years, and it sucks, though.
Yeah, but I mean, that's all I've ever known, and I had surgery done 20 years ago, 2 different surgeries on each eye, and there was a lot of misinformation about what actually was done and confusion about that. And then during the surgery yesterday, when Dr. Gulani actually shaved part of the surface off where there was scarring, it was revealed that there were arcane incisions in there that nobody had ever explained or knew was there. That was part of the 2 surgeries, and that was the problem. That was the impetus or the reason for the scarring. And that's the center of my I've always had bad vision, but my right eye has been my dominant eye, and it had a scar in the very center, so I had to kind of look to the side to even see. And my cornea was so irregularly shaped that the only way that I could even have any kind of vision is to have the rigid lens on there. And even with that, my vision has been declining over the last few years, and it's kind of scary when I think, I'm not that old, and in a few years, if I can't pass a driving test, that's a game changer. What do you do then?
Yes.
I mean, Dr. Gulani really does take it to the next level, because I've done the CXL before down in Miami, both eyes, and it did slow my progression a little bit, but I still do continue to progress. And I also have a juvenile onset glaucoma that I was diagnosed with 10 years ago, so I use drops for that. And Dr. Gulani's experience and his academics and study of all this stuff, he's able to still give us something that we can pursue and do relatively pain-free. I already
checked. A lot of
checked.
confidence.
Checked with my glasses already. I'm seeing a little better, and I didn't think I would be able to see better in my right eye. So, I mean, I think it was a good job.
For me, I've been a keratoconus patient for 40 years that I can tell, since I was about 12, and many doctors back and forth. Nobody could really help you, but just put more like a bandage.
Right.
When I came to Dr. Gulani a year ago, I was basically blind out of my left eye. And through the intake that he did last year and wearing the contact lens, I can see very well out of that eye. And then my good eye, because this was the worst eye, my good eye, he operated last night or yesterday, and I can almost see without the same way as I see with my contact lens.
Yeah, that is awesome.
So, yeah, I wish I would have known of Dr. Gulani a long time ago.
And I wish we all did.
Exactly.
Wouldn't have to go through the things that we went through, but I just so glad.
And to
that
me,
we
what
got a
impressed me
chance.
the most when I came to see him last year, I knew that I was a difficult situation because I could see all the other doctors that I visited, they would be like hands off.
Yeah.
And the second he saw what I had in there, he leaped.
Exactly.
He leaped into it to attack it, and like he knew exactly what to do.
Yeah.
So that
He's
was very
excited.
impressive.
He loves to take on cases
Yeah.
like this to help people
Absolutely.
with their vision. You know,
Yeah.
like I
It makes
said,
you
you're
feel
not just a
confident that
doctor.
it's gonna
Absolutely.
work, that something is
Yeah.
working.
And another thing that makes you feel confident is to know that you're not alone. You
Yeah.
have other people going through what you're going through.
Yeah.
You know, because when it first happened, I thought, oh man, where did it come from? You know.
I want to praise God for using Dr. Gulani and in this field for giving
Oh, that's so good.
people the
Yeah.
confidence and that they're gonna be able to see again. You know, for my wife, you know, she was discouraged and now she can see.
I mean,
It
one
looks
thing-
better out of both eyes, so I just praise God for that.
One thing, just because you mentioned that too, one thing that sets Dr. Gulani apart from me is, if you go to these multiple doctors over and over and over, and like no one knows what to do, everyone's kind of hands off. Dr. Gulani embraces you, and like he really wants to take care of you.
Yeah.
He gives you that kind of like confidence that there is something to do, and like he made me feel really good.
Oh yeah.
Because all the other doctors, I didn't want to deal with them, but I
Right.
didn't have any other opportunities going on.
So it's
But-
kind of like when we were
comforted me a
younger,
bit.
and to be a nerd was a bad thing. So to be a cone is not such a bad thing.
Exactly.
Cones don't stand alone.
Not anymore.